Mary meets up
Yeah.
with the cable here. That's it. That works.
That was better. Yeah.
Oh, and that was right after I unplugged it and then plugged it back in. That's so weird.
So what, I'm sorry, what did you just do?
So I literally just unplugged it and then plugged it back in, and it's like it just then recognized the external microphone.
Huh.
Sensor maybe.
That is so infuriating.
Yeah.
Like, how much sense does that make?
How much sense did 2020 make?
And this is like an iPhone 11 Pro. Like, you would think they'd have this stuff figured out.
So you think it's good enough?
I'm gonna try it.
Yeah.
So I'm gonna go live as soon as they get going. Unplug my crap and plug it back in. Hopefully they'll just be doing the introductions at that point.
Yeah. Yeah, that's
Oh,
weird.
man. And I'm not getting any feedback on the monitor here, so there's no signal on the monitor, so this is all just useless stuff here. I'm trying to be fancy. I'm trying to.
I know, you got all the gadgets.
Well, this gadget right here is from work,
Okay.
and the cable is theirs, but everything else is me just jury rigging stuff.
Yeah.
I swear. And I have no formal training other than like the live test. This works, that doesn't work. Let's not do that again. That's about the extent of my education.
Trial and error.
Trial and error. It's the best way to learn, but it's also frustrating.
Yeah.
I think that my whole mantra in life is like, is not like knowing what's going on. It's like knowing all the things that don't work and just trying to avoid them. That's the extent of my wisdom.
Okay, I'll introduce you as such. Good afternoon. I'm Dr. Sandra Martell, the Public Health Administrator for Winnebago County, and today I'm joined by Mayor Tom McNamara of the City of Rockford. Today we kind of talk about fighting the pandemic from multiple fronts. We've been in this 9, almost 10 months now, but there's multiple actions and strategies being taken. So you've all been working on the social mitigations about the community and the individual levels to reduce the transmission of the virus. Collectively, those actions have had an impact. It has taken 6 weeks to see the impact, but we've seen it. Reduced positivity. On November 12th, our 7-day rolling average peaked at 20.7%. Today, our 7-day rolling average is at 10%. We're reporting decreasing numbers of infections. November 6th, we reported 619 new cases. December 22nd, we're reporting 171 cases. Decreased hospitalizations for COVID-19. On November 9th, our 3 hospital systems reported that they had 191 patients hospitalized for COVID-19. And on November 10th, we were requesting additional beds. December 22nd, yesterday, they were reporting 117 patients hospitalized with COVID-19. So those social mitigations in combination are having an impact. Front number 2 is testing for early identification of cases for quarantine and isolation. The testing site at the University of Illinois Health Sciences campus on Parkview will be closed on December 25th, Christmas Day, and January 1st, New Year's Day, but it will operate routinely on all other days. That test site will also be relocating to expand capacity on January 2nd to our formerly Kmart site at 1321 Sandy Hollow Road. The hours of operation will be the same, from 8 a.m. to 4 p.m., 7 days a week, but they expand the capacity there. Stay tuned for more updates, but please continue to pre-register through Test Directly, testdirectly.com. This will expedite your testing experience and increase the accuracy. We've also seen our community adopt and start implementing the Binax Now rapid antigen testing on a larger scale. So in front number 2, we have increased capacity and access to testing. Front number 3 is contact tracing. Our contact tracing team continues to identify close contacts for quarantine and isolation. Front number 4 is expansion of treatment to individuals diagnosed with COVID-19 with monoclonal antibodies and convalescent plasma to reduce hospitalizations and complications. And front number 5 was vaccination. Vaccination started with Phase 1A healthcare workers is continuing over the holiday week. I think most of us have all heard earlier that over 100,000 Phase 1 healthcare workers have been vaccinated in the state of Illinois as of December 23rd, today. And of all 50 states, Illinois has administered the highest number of doses to its healthcare workers. Winnebago County Hospital Partners vaccinated 5,146 Phase 1A healthcare workers in its initial vaccination effort. And next week, pharmacy partners CVS and Walgreens will start vaccinating our long-term care facility residents and their staff. So when we talk about this pandemic, when we started this pandemic, we maybe had testing. We now have the social mitigations, we have the expanded testing, we have contact tracing, we have expansion of treatment, and vaccination. So we have things to be hopeful for as we start the new year. But having said that, we are still having new cases. Today we're reporting 171 new cases, and they're aged 3 years to 100 years. And our total cases to date are over 22,000. Our test positivity 7-day rolling average is under 10% at 9.3%. But unfortunately, deaths often lag. 7 additional residents of our community lost their life to COVID-19. Our condolences are extended to all of those families. It is particularly difficult during a holiday season to recognize the loss of our community residents. We mourn their loss with them. And that brings our total deaths in Winnebago County to 336. Our recovery rate is 98%. So as we kind of come into the holidays, it's difficult. We need to continue to be vigilant over the holidays to prevent the transmission from all of those fronts. You need to continue to minimize contacts with others outside of your household. Celebrate at home as much as possible. Celebrate virtually with those outside of your household. Continue to support our local businesses and order carry-out for your holiday meals. Wear your face covering when it's outside of your home. Work remotely as much as possible. And stay home if you are sick. The Winnebago County Health Department will be working over the holiday break, with the exception of Christmas Day, for contact tracing, vaccination efforts, and enforcement activities. But the hotline will be taking a break and resume on Monday. On behalf of the Winnebago County Health Department and the Winnebago County Board of Health, we wish all our community a healthy, hopeful holiday season. And with that, I will turn it over to Mayor McNamara.
Thank you, Dr. Martell. And as I do each one of these, I want to say thank you to you for your leadership, but I think it's important that all of us in the county take an extra second and just applaud Dr. Martell. When you look at this year, I can guarantee you she did not think her and her team would be going through a pandemic on January 1st. And you've helped lead our community through it with tremendous professionalism and a whole lot of compassion. And I just want to say thank you on behalf of the citizens of Rockford for your leadership during these difficult times. So locally, on a different note, we are encouraged. We're continuing to see lower positivity rates, as Dr. Martell said. We're now at about 9.3%, and we are seeing fewer new cases overall. Our hospitals are seeing a slight decline in patients and that they're treating for COVID-19. And as Dr. Martell just mentioned, we also saw some really wonderful news now that more than 5,000 of our healthcare workers, who you have to say are some of the hardest working heroes that we've seen throughout this entire pandemic, have now received their first round of vaccine. And more vaccines are on their way to Illinois and to our region. We may finally see that light at the end of the tunnel that we've been talking about, but yet it's still quite a ways away. As Dr. Martell mentioned, we need to continue to be vigilant, and I don't think we need any more of a stark reminder of why we need to be vigilant than hearing the news, really sad news, of 7 more families losing a loved one. Please continue to be vigilant. As we begin to celebrate Christmas and the New Year's over the next couple of days, I want to say a sincere thank you to those who have taken the really difficult measure of canceling their plans and their get-togethers with families and with their family and their friends. Those who have put aside their typical annual traditions so that others in our community can remain safe. Thank you to those who have sacrificed personally so that all of us collectively as a community can be healthier. I know personally how hard that is, and I sincerely appreciate it. Maybe you're seeing others during this time, still traveling, still gathering with their friends and families. I just want to say you have made the right choice. And although it's a very difficult choice, but you have certainly made the right choice, not just for yourself and your family, but for our broader community. I want to again just say thank you. I'll just close quickly by saying a sincere thank you. I've thanked Dr. Martell, but behind Dr. Martell is really some amazing people at Winnebago County Health Department, at the Emergency Operations Center, at all of our local health systems who have helped lead us during these really difficult 9 months. So just a sincere thank you to all of them and all of our frontline workers. The small sacrifices that you at home are making are really starting now to show some dividends for us as a community, and we are beginning to kind of, as I mentioned earlier, see that light at the end of the tunnel and see that finish line that we've long sought after. So looking ahead to 2021, there are certainly brighter, happier, better days for our community, Winnebago County, and our region. So let's continue to be smart. Let's continue to take care of one another, continue to check in on one another, especially our senior residents in our community during this difficult time, and say an extra prayer for the hundreds of families who now will have that empty seat at their table during this really difficult holiday season. With that, on behalf of myself and the City of Rockford, I wish you all a Merry Christmas and a Happy New Year. And we would take questions at this time.
Dr. Martell, did you say beginning January 4th that testing is going to be moved to the Kmart on Sandy Hollow Road, is that correct?
January 2nd.
Oh, January 2nd, forgive me. Why is it being moved?
Well, first of all, I think, they wanted to get a larger footprint. There's been a recognized need for continued testing and the demand for testing. And so we also know that as Crusader Community Health transitioned back into their care centers and began their plans for, remember, their patient care providers. So part of their, not only are they focused on their testing of their patient populations, but they're preparing for vaccination of their patients and also treatment. So it really becomes critical that they begin that process. So we wanted to find a location that could expand the capacity to meet the needs of our community, of the amount of testing that's been being done throughout the past.
Both you and the mayor have expressed optimism today. Are we months away from a return to somewhat normal times, or is there any kind of prognostication you could give at this point?
So the question is there any prognostication that we seem optimistic? I wish I had a very clear crystal ball. By all accounts, if you look at the national information and the world news, is that we're really thinking that as we move through these vaccination phases, it'll become very important, even while we're getting vaccinated, that we're continuing to wear our face coverings, that we may continue to have to limit our social gatherings, some of these other mitigation strategies, that by spring to summer we'll start to see some lessening, with the goal of the fall really being a time where we can return all of our children into in-person learning and be able to kind of, when we say back to normal, but certainly with understanding that we will still have to protect some vulnerable populations potentially. So it is a long road ahead, but we are on that journey and we are in that tunnel. We can see the light. We can't bypass the tunnel. We have to go through the tunnel. But we are beginning to see, when you think about the pandemic, and I really mean this, when we were talking about those fronts, when I started in March, the only thing I could talk about was we have no effective treatment and we don't have an effective vaccine, right? We talked about the importance of getting tested. We didn't even really recommend face coverings initially, right? We were really stuck with very limited tools. So despite the fact that it seems like a long time, we are building that tool chest and we are using all of our tools to get through that tunnel to the light. So I think with that sense of optimism, we are developing and using our tools in this community to the highest effective level we can.
Dr. Martell, going back to the moving of the testing site, how many more COVID tests will be able to be administered at the Kmart location than at UIC?
The question is how many more tests they plan to perform. They have indicated that they plan to have a capacity for at least 1,000 per day.
And what's the capacity currently at the...
Currently, the capacity was, they were anticipating about 400 tests a day. Most of them were running under, but the traffic back up on, I think, Parkview is becoming a deterrent for people to come, right? If they saw the line was too long, decided whether or not that would be important. I'll go home and isolate.
Were any other sites considered?
This is the state-run community-based testing site. So they were looking for a large footprint that they could be there for a long period of time, that it was accessible from different roadways that would not impact as we hopefully bring on some of our businesses back. We don't want to clog up their arteries as well, so that, part of this would be to make sure that we could make it accessible. In addition, with the Binax antigen testing being more available in local offices throughout the community, there won't, again, we've got expansion at the local level as well as a community-based testing site that's doing the PCR testing.
Did we see that spike in cases after the Thanksgiving holiday, and is that something that you expect to see heading into the Christmas and New Year?
The question is, did we see a spike following the Thanksgiving holiday? We kind of plateaued at the high level. We did not see an additional spike. And so we're coming down on the positivity, our number of new reported cases per day, but we're still, remember, the deaths lag, right? So we have that kind of, process we've got in place. But we don't want to experience another spike post-Christmas, New Year's holiday. And I think really, we talked a little bit, last time, and really, I think the mayor was right in thanking the community of, yeah, you put your plans on hold, you made your Thanksgiving smaller, you kept in your households, with the intent that, again, we've talked about protecting our lives and our livelihood. If we want to move out of mitigations as a region with our other regions and the state, you know, we don't want to have a surging infection rate because, again, our hospitals are still in a very fragile situation. The hospitalizations have not gone down completely, but they have lessened.
And Dr. Martell, we understand that where we are at right now, we are below that 10%. We have been for a while now. And we do understand that we do in Region 1 meet all of those requirements to go down to Tier 2. And we did talk at the local pressers just a little bit ago, a few weeks ago, last week I believe it was, that hey, we are looking towards opening indoor dining. However, the state says otherwise it could be mid-January. Can you talk on that comparison?
So the question was, we talked about Region 1 has been below what the mitigation kind of threshold was at the 12% and moving that down, and we've been in lowered positivity rate. The challenge is the rest of the state around us. And again, if we've learned nothing else about this, is that it really does require a much broader regional approach. So we are just in the state really beginning to start down, you know, kind of you see the numbers trending downward. Chicago talked today a little bit about their decreasing numbers. And you start looking at the challenges. Can we all do it together over the Christmas and New Year's holiday? Can we stick to it so that we don't spike up cases mid-January and basically open up businesses and shut them down again, right? Because we've heard that time and time again. You know, if I'm planning to open and I start getting my workers back in, I start purchasing product, to then have to travel backward is not effective or helpful either. And so we have to, as we go through this, both the mayor and myself have really advocated through our channels to start saying we need to begin to start talking about this and how do we bring things back online in a safe manner that is also I'm going to stay in step with other regions because the challenge is we don't really live in a bubble. And so it's going to take all of us.
Will the local health department kind of follow suit then with other regional decisions or with the state decision? And if those differ, will there be different decisions locally?
Well, the question is will the health department follow with other regions, right? And then the second part of that is, will it follow the state guidelines? Well, first of all, as a certified local health department in the state of Illinois, my authority comes from the Illinois Department of Public Health. But as a public health leader, part of my job is to advocate, look at the numbers with my, leadership at the state level, and say, what can we do collectively to start this gradual, what's appropriate as we lift mitigations. Now, I've heard everyone, can we just return back to Tier 2? Well, for those of you who remember, there wasn't a whole lot different about Tier 2. There was still no indoor dining at that point. We could have some smaller social gatherings, but many of the mitigations were still in place. It's a layering of those mitigations, so we're going to have to slowly come back and, kind of limit that, reduce that mitigation, kind of a double negative, I apologize, but remove some of those restrictions, see how it moves, and then start moving it back up. But the challenge is everyone wants it to be all together at the same time. And that has not worked really well because we end up with a spike. And so when you start looking around the country, Indiana is another state that's adjacent to us that has experienced a very high rate. And while we continue to look at the travel guidance, we talk about that, we talk about quarantining after you return, all of those have to be in effect in place. And people need to understand how do we adhere to that so that we can begin to come out of this gradually so we can monitor and keep our infection rates low, because I've heard, not everyone will be able to be vaccinated in the next 3 months. So right now it's just healthcare workers. We're going to be in this phase 1A for a while. So I want people not to think, tomorrow, right? I've heard, can I get one tomorrow and then, get together with my family? No. It takes 2 vaccinations, depends upon what product you get. And it's going to require at least 80% of us to be vaccinated, according to the scientists, and the science around immunity in the community to really begin to squash this pandemic.
Dr. Martell, you had mentioned that we will be in this phase 1A for a while, helping those healthcare workers get those vaccines. We have noticed that there are a lot of hospitals in our area that have completed that tier. And so there is a lot of talk about, okay, who is next, especially too with the Moderna vaccine coming into play. And so a lot of as well educators are wondering if they're going to be kind of getting their vaccines maybe a little bit earlier. What do you think about that timeline?
So this week we learned from the Centers for Disease Control and Prevention regarding some changes in the, really what they call the phases. So I'm going to, and I don't mean this in any kind of mean sense of way, but we always say there are about 3 Ps we've had to deal with this year: planning, pandemic, and pivot, right? So as things get, as we learn new, so we've learned a little bit more about this phase 1A being healthcare. And it's just not healthcare workers in hospitals. I want to be clear about that. The hospital partners have gone through not all of our health systems have finished all of theirs. Smaller hospitals may have, community-based hospitals. But then we have all the community providers. Think about our dentists, our blood bank, our kidney dialysis centers, our ambulatory surgical centers, our home health care agencies, our hospice, our mortuary care, all of that group. Those also need to be vaccinated as part of phase 1A. So I would say hospitals, a little bit easier to vaccinate that group because they're in those walls. Much more challenging to start bringing in those other groups that are a little more loosely affiliated and connected. But that's what we're working on over the next week. Not to mention our EMS providers, our pre-hospital providers, right? The ones that transport us into the hospital. So we are working very, in a coordinated fashion to bring all those healthcare providers in, recognizing that 1A is a large and diffuse group of healthcare workers and providers.
Where do first responders stack up in terms of getting vaccinations?
And when you say first responders,
Police, fire.
so police and fire, so if you're an EMS, you're a healthcare worker.
Mm-hmm.
So as we go through the phases, the next phase we heard was being released was individuals 75 years of age and older, and I apologize, I forget the second one, we just redacted it, and I will get that for you. But again, we start that process. So we still haven't gotten through all our long-term care facilities and our congregate settings that where elderly individuals most at risk are living. But every group will have that. The next group is essential workers, and I'm sorry, it's those over 70, those who are 75 years of age and older and essential workers. They are going through the process now at the state level to identify what those critical essential workers are. Because we all want to be in step. We don't want to find one county's doing it differently than another. But counties may go through their phases quicker depending on their population size.
Dr. Martel, can you touch on the Moderna vaccine a little bit of maybe if we have an understanding of when that shipment might be or what the next shipment of vaccine, whether what kind it is, will be, how many, and where it's exactly going?
So the question is about the Moderna vaccine. When can I expect it? Where is it going to go? And here's where we're going to go with P-Pivot. So we, again, the product that we got a second shipment of was Pfizer, not Moderna. So we're using Moderna right now. We anticipated product, and then we are also anticipating by sometime either at the end of this week or beginning of next week to begin our first Moderna shipments. Now, first of all, both vaccines are highly effective and both work on the same technology. One requires much more, I'm going to say strict freezer requirements. You've heard about the super ultra cold. It's quite a very fragile vaccine to manage. You have to keep very tight controls, which is why we start in the hospital walls first, right? Because we're close to freezer space. We're close to very tight, so you have to thaw it for a certain length of time. It's only good for a certain length of time after you thaw it. So we're very tightly controlled about getting that vaccine so not one dose is wasted. It's not like you want to defrost something and then say, oh, nobody's coming, can't use it. Moderna has a little bit more flexibility on that, and so you start seeing it going to other health departments with smaller footprints, right, based on the way it's packaged. And so both vaccines very effective. We will use the vaccines as they come in, and we will use it so that we can quickly move through our phases.
What is the schedule of them coming in? How often are shipments coming in?
So the question is, how often are shipments coming in? We understand the shipments will come in weekly. Do we know when all the shipments are coming in, and particularly? No, we don't know.
But they'll be weekly.
But we understand they'll be weekly. We don't know. Again, once they get into a cadence and a rhythm along with the federal distribution, Then the state has a distribution system, and they will be looking at how each county and health system is vaccinating through, how it's going through its product, because again, they would not want to ship a lot to a county that is not going to be able to use it right away because of the fragility of this vaccine and the need to get it in as many arms as possible. So we were very clear about what we were going to be doing this week over the holidays. We had to be clear about were we going to vaccinate over holidays? Were we going to be open on certain days? That's kinds of things to receive shipments. This is a well-coordinated, orchestrated shipment, delivery, and then getting it to the locations for the vaccinations to occur.
When do you think the general population here in Winnebago County will have access to the vaccine?
Well, if you read some of the plans and where we're at, it wouldn't be till much later in the phases. So we'll be going through critical infrastructure, then there'll be healthcare risk factors. And, we've talked about, and our plan is up on the website, and we have to revise it every time they come out with a revision to the state plan, as well as to any federal changes. We did go through ours with a health equity lens so that as we begin to roll out to the population that does not in part of these special categories as part of the rollout, that we are going to be vaccinating and really offering at higher levels to populations most disproportionately impacted.
Dr. Martell, you had mentioned that, of course, through as the vaccines kind of trickle down to that state and local, they're going to be determining the number of vaccines based on the population and what hospitals can offer. Do we know when that next shipment next week that you had talked about, do we know kind of a number?
No, we do not know a number. Thank you.
Dr. Martell, what has it been like for you throughout these past 9-10 months when this pandemic all started to now? We're ending the year and we have a vaccine. What has it been like for you?
So the question is, how has it been for me? Well, sometimes it's unreal. I think if you were to ask me, would be this where we'd be at this time? And every day you come in and you say, what can I accomplish? What's most important? What's the priority? So remember, I'm planning and I'm pivoting at every time that there's a change throughout this pandemic. We were, when you think about vaccine, we were taught maybe it was going to be in the first quarter of 2021. Here we are seeing at the end of 2020. So, and then really the commitment of an entire, staff behind it. You see me come down every day and they're running the numbers. They're doing all the contact tracing calls. They're doing the code enforcement, yes. They're on the hotlines listening to people. We have a vaccine planning team now that's taking all the data, and as we are pivoting and trying to get all these special groups in for vaccination over the next, doing those manual calls, right, to get the consent out to them, to get the emergency use authorization, fact sheets out to them, to prepare them to come in over the next, days to get vaccinated in a safe and effective way, right? And so, again, kind of really just reprioritizing every day. I say you have to kind of really kind of reprioritize. Every day we're pivoting on something. And the important thing to know is that we are working hard to really get through this pandemic. My statement always is, people ask me, how am I doing? I'm saying, live in a dream, survive in a pandemic. At the end of the day, I want all of us to be through this pandemic. I want everyone who wants to have had a vaccine to have received a vaccine. I want you to be able to be back with your family members. I want us to be back out socializing along the riverfront, enjoying our restaurants and our food establishments. I want us socializing again. And I want to be able to visit our family members in our, long-term care facilities that have been isolated. I want our kids back in school. So I think I have similar goals for all of us. If this is what, every day I come in with a mission, and I am committed to this community to get us through this.
Is it hard to believe that in the same year we had our first case of COVID and we're also having our first vaccine within 10 months?
So the question is, kind of that whole warp speed. And we've been asked about the question before about, are we concerned about this, the first case and the first vaccine? It's the technology behind that vaccine. When you think about the data in years ago, even if I think about H1N1, I went back to look at, we had to go back and say lessons learned. So much was on paper. We now use computing like it's, second kind of nature. I think about the contact tracers now whose headsets are go right into the dialing into the system and some of those supports that are there. And so the research behind it is still tried and true, but the technology to support it has advanced us much faster than we had, than we've seen in other, but that should not in any way, shape, or form really kind of diminish the trust that we should have in this. I think none of us would be going back to using, an adding machine now that we can, use an Excel spreadsheet. Anything else? Again, Merry Christmas and Happy New Year.